So my name is Andy Whapham and I'm a social worker in the Carshalton and Wallington review team. This will be my 6th year. I qualified 6 years ago. It's a very varied career. It's something that really taxes you and pushes your skills a long way. And I think you find out a lot about yourself doing this kind of work. It requires a lot of resilience, mental and emotional resilience, because you can work in some very difficult situations at times. But the other side, I've made some really good friends and colleagues who are very inspiring, and a lot have become real role models to me because of the work they do with people in our community. I worked years ago as a support worker in a hospital, and I always kind of wondered what happened to people, their journey after that. And then when I had the opportunity to do a bit of volunteering with Sutton Carers Centre, and that gave me the kind of the insight into wanting to support the community, because I live in Sutton, I grew up in Sutton, and being able to support the local community and the people within it was something that really appealed to me. There is no typical day. You can come into a day with a plan, and quite often that plan goes out the window, because we respond to a lot of emergency situations with regards to clients in crisis. So you can have a plan for the day, but often it doesn't go according to plan. We tend to, we need to spend a lot of time going out on visits, meeting clients, attending meetings with partners in health and the voluntary sector. And there is a lot of writing, emails, and spending time writing up assessments and reviews and things like that. So there isn't really a typical day. I'd say go for it, absolutely. But I think do your research, try and when you come into social work, I think it's about finding a pathway that suits you. So in that, I mean, there's so many different areas of social work. There's children's social work. Within adults where I work, there's mental health, there's substance misuse, dementia, older people. So it's finding the pathway that really interests you, because I think if you're engaged in what you do, then you're passionate about what you do, the people that we support and that we work with will undoubtedly benefit from that. Rewarding, because when things go well, it's a great feeling to know that you've made a difference, and in some cases it can be life-changing. So I would say rewarding. Challenging, I think, because there's a lot of, you need to be organised, and you're responding to crises and things like that. And I would say probably exhilarating as well. I think you do get, it kind of, sometimes you get swept up in it. So it's kind of exhilarating, in those terms, so yeah. I'm proud of my ability to, I guess, what I would call my people skills. I'm able to sort of sit down and build a rapport with a variety of different people, whether that be older people, younger people, people with learning difficulties, dementia. I think I'm quite proud of those skills. And some of the success stories I've had with clients, sort of drug and alcohol clients who've got clean and really turned their life around, that to me is something that I'm quite proud of. I think for me, because I think it's about I'm working in my community. This is where I live, this is where I grew up. I know the community, I know the people. And Sutton, the people that I work with day to day, my colleagues, I honestly couldn't ask for better colleagues. They're very supportive. When things get difficult, I know that they're there to support me. There's great opportunities for training and advancement. And I think overall it's a good fit for me. It works for me, and I would highly recommend Sutton to other people.